It seems like you can hear me. How are you doing? It's a brand new month, brand new week. I hope you have had time to plan your month, reflecting on those New Year resolutions which we have forgotten about, and maybe looking at what is it that you can do the next 30 days. And if you have clarity about that, then you come back and say, week one, week one, week one, week one, what can I do so that I can ace all those priorities? So, yeah, me just helping you to plan, but to help you to continue to pursue your dreams and, so that you can be someone who grows every day, every single day, every month, every year. So, yeah, it's such a great honor to host you as always. You know how excited I become when I realize that I'm going to be with you, but I'm never alone. Brother Ryan, welcome. Welcome, brother.
Mm. Thank you. Good evening. Where's your glasses, brother? No glasses today.
No, no, you have my glasses. I see you have put them on there.
Yes, I think you need to get a new prescription though.
Yeah, are you otherwise well?
Good. Hope you are
Awesome.
too. Hello, everybody.
Yes, welcome, welcome, colleagues. Yeah, so yeah, this session is supposed to take us just 30 minutes. Let me share my slides so that you can see what is it that we have for you for the next 30 minutes. Yeah, I hope you can see the slides and you can hear me. Let me just check in couple of people who have joined. Let me see who's there. Yay, we've got Eva. Eva, hello. Welcome, Eva. Maritza, as always. Mihloti, Alfred, Tau, Francina, Abdulaziz. Welcome, colleagues. And I'm so happy that you seem to be representative of our beautiful country and our very colorful flag. So everybody is welcome. And yes, Dr. Ngwenya, our head of DRTB in Gauteng. Welcome, brother. It's always great to see you. And thanks for greeting me in my mother tongue, Dumela. Yeah, so this is the information session, and we are preparing for our Saturday masterclass on ECG interpretation. This aligns very closely with our mission to improve patient care because ECGs are so valuable. You know, whether you are evaluating someone in an emergency center, you always need your ECG. In your GP practice, hey, I have palpitations, or I don't know, I don't think my heart is beating the way it should. ECGs are so valuable. High care, ICU, if you think of in theater, if you are giving people anesthesia, I mean, ECGs are such an invaluable tool that we need to have. So yeah, let's proceed from there. Just to say that these are some of our aspirations as a platform, you know, to try and be simple, fast, and efficient, responding to your needs, but also creating situations like this where you can have meaningful engagements with some of our instructors and experts in various fields. So we are so really, really happy for having a chance to really add value to your lives as health professionals. I live, by a motto that says I want to be better every day. But I realize that to be better tomorrow, I must grow today. And to grow today in whatever specialty, whatever skill, whatever that is that I want to master, I must spend at least 1 hour in that. So this platform creates that opportunity for you to hone your skills and to become better. We are a membership-based platform. Do visit our website to learn more what our membership offers, but more than anything, it offers you a peace of mind. This is what a masterclass is. So we basically take something that could be a master's program or a diploma or even a certificate program over a number of weeks or days, and we're trying to say, can we identify critical things that if we put them and you are able to process them, you would master the skill without really spending weeks and months on a topic. So these are generally intense evidence-based events high yield, lots of information, but don't worry about that because as soon as the masterclass is completed, we give you access to the self-paced version, which you can go through during your own time, rewind, fast forward, pause, Dr. Ryan as many times as possible. But these are hosted on Saturdays, and you can see some of the masterclasses we have, especially this month. We have sort of four that we need to try and go through. This coming weekend, we have the ECG Interpretation Masterclass, and then this will be followed by the third bullet there, ophthalmic emergencies with our dearest can get Dr. Mang. Anyway, Tabiso, Dr. Tabiso Mufokeng. We will close the month with our final FCP intake. Don't miss it because we clustered three key things there: neurology, dermatology, and statistics. That will close the series nicely. And then we're going to end up with a cherry on top: cervical cancer prevention and management. And this is the series as it comes. So check what's your interest, and then fit in somewhere there and join us. And yes, the diplomas are back, and particularly linked to today's session is the Diploma in Internal Medicine Preparatory Program. I'll share the link later on if you are interested to join our next intake, which is now open, for interest or registration. We start first week of October. We are rolling through preparing people who are planning to write their February exams, or if you have an inspiration to be competent by that time, we are happy to help you. Just to go back to say, we have also the HIV management diploma preparatory program, obstetrics, and also child health. So check where you fit in. But if you have joined tonight, it means most likely you love internal medicine. And yes, we are loved by yourselves. Please, give us a thumbs up there and say, yay, I'm part of those people who really, really appreciate the work that this platform does, because we get a lot of inspiration from your feedback. Without wasting a lot of time, today we are here to get a sense of what we can expect come Saturday. And we host our dearest friend, our dearest instructor, my dearest brother, Dr. Ryan Pesat. And yeah, I can read his profile so that maybe you can get enticed to say he's qualified to do the job. But I think the biggest job he's qualified to do is to keep us happy, feeling good about ourselves, sharing those dirty jokes. And I can't wait to get tonight's first one. Brother Ryan.
Good evening, everybody.
Welcome,
Thank you,
brother.
Brother Mawela. Thank you. Okay, let me give you a joke, right? So you're talking
Please.
about the ophthalmic masterclass on emergencies. So how come eyes make such good teachers?
Uh-huh. How
Because they
come?
only have one pupil.
So I only need two students. So I've had two.
True.
Colleagues, I hope you are laughing with me as I laugh. If you're not laughing, let me give you the horn. Thank you, brother.
Thank you, brother. Thank you. Good evening, everybody. Thank you for joining us on this beautiful Monday evening, even as we talk about the upcoming ECG Masterclass this Saturday. A big thank you to my Lord and Savior Jesus Christ for the opportunity to be here and to present on this platform. And of course, a big thank you to our dearest brother Mawela. As you can see, this is a mugshot of brother Mawela. He's most wanted for being the most helpful instructor in South Africa. Thank you, brother, for your sacrifice and dedication and commitment. And also thank you to the good folks at the CCP for all that you do. It does not go unnoticed. Thank you. Oh dear, what is this? Well, we're all about ECGs on Saturday. And yeah, ECGs can be intimidating, it can be a bit scary to interpret, but it's a quintessential part of the practice of medicine. Okay. So this is a bird's eye view of various kinds of arrhythmias and patterns that we will be reviewing. And you're going to be very competent come the end of Saturday's masterclass. Okay, so What are the objectives of the course? To recognize any ECG abnormality that you may encounter during the routine practice of clinical medicine, to be able to list the etiologies of all these abnormalities, to understand the limitations of the ECG, and to discuss how to incorporate the ECG into your clinical decision making. Okay. Then who is this course for? Well, any healthcare provider who will ever need to read an ECG. So you may be a physician, you may be a doctor, you may be even a nurse, even paramedics, who have to interpret those ECGs in the ambulance with patients who present with chest pain and dyspnea and palpitations and syncopal episodes and so forth, right? And even if you're a student in the above fields, medical students, even intern doctors, community service doctors, nurses in training, paramedics in training. All right, this course is for everybody. So we organize the course into different sections. These are the different chapters, essentially. So we start off with the fundamentals in terms of introducing waveforms and how to go about setting up the ECG in terms of lead placement. All right. And then we're going to talk about how to measure heart rate and axis, QRST changes. Then we're going to break into arrhythmias. So there's tachyarrhythmias, bradyarrhythmias, talk about bundle branch block, a little bit on ventricular hypertrophy. And I got two big chapters looking at ischemia and infarction. And then we're going to consolidate everything together nicely in terms of a quiz. All right. This is just an example of some of the slides that are going to be featured on Saturday. So this is basically, I have a lot of, illustrations and that. So this is basically showing you how to set up the ECG, lead placement and so forth, and which leads are placed where. And then this is an example from localization of the different ischemic changes. So, we talk about stratification of leads in terms of territory. So we talk about the inferior territory being 2, 3, and AVF, because that's colored for us in purple. Then in red, we have the far lateral territory, which is 1, AVL, V5, V6. Then we have the septal territory in blue, which is V1 and V2, and the green V3, V4. And so when you hear the terms inferolateral, anterolateral, septal, posterior, inferior, then it obviously makes sense in terms of how we arrive at these designations, okay? This is an example of left ventricular hypertrophy. So just to give you guys an idea of how the slides are set up. So LVH, and then, we talk about these specifically mentioning specific pathognomonic changes in specific leads and what these changes are in terms of the waveforms. Okay, we get into quite some detail. I even zoom into specific leads to illustrate specific findings of interest. And this is an example from our quiz. Mention the abnormalities in the above ECG. Can anybody spot it? Well, there's diffuse ST elevation. Look, there's ST elevation which does not respect vascular territory. It's in the septal territory, it's in the anterior, it's in the inferior, it's in the lateral. So this is typical for pericarditis, okay? And the number one cause for pericarditis in sub-Saharan Africa is T to the B, TB, right? And there's a whole host of other causes as well, okay, as mentioned. No, we're not going to go through these now, obviously. We'll save that for Saturday, okay? And I got another joke for Brother Mawela. I chose not to go to the doctor for my skin irritation. It was a rash decision. Brother Mawela, that's my segment done. Over to you. Then.
Thanks, brother. I thought that was that was something else. Thank you, colleagues. Yeah, I
Drum
thought
roll.
before I show you how to navigate, I should play you a snapshot so that you can get a sense of what you have missed previously and what you may miss going forward if you do not join us. Are you guys ready for the snapshot? It's gonna take us like a minute, but it's a very insightful teaching by Brother Ryan. So let's go through it. Let me know, but I know that you're going to be good. Let me open the video first, because if you can't see me, you won't see it. Okay, let's go.
So it's time for us to see this in action. A beautiful 12-lead ECG, right? We're going to take about maybe 5 seconds just to stare at this ECG and try and decipher what's going on. All right. So Here we have it. List the main abnormalities. We see beautiful ST elevation in the inferior territory. 2, 3, AVF. Boom. Very nice. But that's not all we see. We also see ST depression with inverted T waves in lead 1, right? We also see it in AVL. There we go. And in V2. Hello. This is what we call reciprocal change, right? We are infarction in one area, and looking at the heart from another angle, we see ischemia. We took that same ECG and we flipped it around, right? And if we read this ECG from right to left, then what was ischemia, as in 1, AVL, and V2, now looks like ST elevation myocardial infarct. If we look at what was infarction in 2, 3, and AVF, if we read it from right to left, now looks like ischemia. That is the beauty of the electrocardiogram, because guys, we're looking at the same heart, but from different vantage points. Hence, we use the term reciprocal change. So this is an inferior myocardial infarct. But in the anterior territory, we have ischemia. That's reciprocal change coming from the inferior event.
Usually, after watching this, there's 3 things that are going on in your mind. 1, you are like me and you are like, what's going on here? If you are like me, don't worry, you are not alone. At least there's you and Dr. Mawela. And maybe you should join us on Saturday so that when you see those funny graphs going up and down, and Ryan keeps on saying some are depressed, some are elevated, you don't panic and you know what to do. Or you are very good with ECGs and you are like, wow, this is awesome. You know, how can he teach it like that? And can I teach other people? Yes, you can. Join it, master it. And you know, we always say, see one, do one, teach one. And if you start teaching other people, adding value in their lives, you become an expert yourself. So yeah, what a nice one. I'll play it again towards the end. So yeah, just to then I don't know if you'll be able to see this, but I just want to narrate what is going to happen um if you opt to, let me see, yeah, here we go. I hope you can see the website. I know people who are joining us via streaming, you may not see it, but as I narrate that, for you to register for this, you have to visit our website www.clinicalcareplatform.com. That is our website. If you get to the home page, you know, or you can just click on home, you'll always find upcoming events, especially master classes, on the home page where you just scroll downwards, or the workshops tab, and then you'll find a number of either upcoming webinars and stuff, right? But we are on the home page. All we need to do is to scroll down. As you scroll down, you will find the ECG Masterclass happening on the 9th of August, Women's Day. That's how we are going to celebrate our women, by preparing to take good care of them when they are not well. And one such skill is an ECG. You click on learn more there. It will take you to the course page where you can read more about this course. What does it cost? It's not a free course, but if you're a member of this platform, you are eligible for at least 10% discount in that space. Who's the instructor? What are they all about? There's also a very nice teaching there, which is linked to the snapshot that I was just showing you. So it's another way to just get a sense of what to expect, you know, etc., etc. If you have made up your mind, you just say, I want to register today, and you click on the register today tab, which is on the course page, right? You would then be taken to the registration and payment page, which only requires your name, your surname, your email address, and then your phone number. Okay, I'm going to see if we can add your council registration number somewhere there. But anyway, this is the basic information that we need. You have an option to join our upcoming masterclass in ophthalmology right there. if you are interested, and it always becomes a bargain when you register for two or more. You can see already that the ophthalmic emergencies, there's a saving there of at least 100 rands. If you are a member, you are interested in, do you have a coupon code? You say, yep, I do have because I'm a member. Then you type in there in capital letters, member, and then the number 25, right? Make sure there's no space before member, there's no space between these letters and the numbers, and there's no space thereafter, and it's member 25, and it should be in capital letters. You say, please apply my code. I'd like to enjoy the benefits of being a member of, look at that, a further 180 rands saved. Then you click let me complete, and then you then put in your payment details, you register, and then my team will then reach out to you with further access details. You can actually trust our platform. It's quite secured. We do not see your personal details to the bank, etc. This is facilitated by a very trusted payment gate here in South Africa. Pay Fast. I think you must have used it at some point, both Zappa and all those things. So there's a direct communication between your card and your bank in a secured manner. And yeah, we hope to join you, or for you to, or to see you on Saturday. Let me welcome Brother Ryan back so that we can have a quick discussion. A couple of seconds as I try to find him. Yay, there he is. He's so relaxed. Do you see, guys? Yes, we can see you, Brother Ryan, and we can see that you are sitting comfortably today. The last time I saw you, you were standing, so this is good. This is good. All right. Yeah, so Brother Ryan, let me see. Oh yeah, I saw you
And what
replied
happened is
because
my connection was bad upstairs, so I came down. Yeah.
oh, okay. No, no, no. We like it downstairs. We like it downstairs. I'm happy you replied to Dr. Tamsang, referring to clinical associates. I always ask you, ECGs are used by so many people. I always ask you who else can get value, from nurses. I mean, for the medical officers, it's kind of like obvious. But would you like to emphasize the benefit for clinical associates and registered or nurses working in ICU, etc., etc.?
Oh, absolutely. Brother, I'm not sure if you can hear me because my internet's quite bad.
Okay.
Um, yeah, but ECG, brother, can you hear me?
Yes,
Yeah?
I can hear you for now. Yeah.
Okay. Yeah, like you said, ECG is absolutely essential tool. Whether you're working in emergency medicine, in ICU medicine, in outpatients, whether you're a paramedic or a clinical associate, ECG is an absolute must. You need to be comfortable with how to set up an ECG, how to interpret an ECG, and how to act on the results of your ECG. Because, we have arrhythmias, we have heart failure, we have acute coronary syndromes, pericarditis. We can even talk about systemic issues as well, like hyperthyroidism, fever, anemia, and specific signs in the ECG. So very important from clinical associates all the way to doctors. This is a must.
Awesome, awesome, awesome. Yes, and as maybe from my side as well, to remind you, colleagues, that this is a paid event. It costs 950 rands. There is a completion certificate. You also get 7 CPD points. Since it's a paid event, everyone who registers will get their certificates and CPD. So it's not just only CCP members. But if you're a CCP member, you should be able to access this program with some savings in your pocket, which then makes you feel that there is value in joining us on this incredible journey. Someone, Pinky, really laughed your joke, your initial joke. Says, "Right is such a comic." So please, Brother Ryan, keep them coming. My follow-up question to you, was to say, because I had a couple of them, but I think in your response to clinical associates and nurses, you sort of responded to most of them. What I wanted to ask is, do you feel that we get exposed enough undergraduate in the undergraduate space? Do we get exposed enough to ECGs? Because I see that in the workplace we struggle first before we get it right. What's your experience in your area?
Yeah,
Mm,
very, very good observation, brother. I
mm,
mean, speaking personally, we just pick up ECG interpretation in the wards, you know?
mm,
It's
mm,
not something that was formally didactically taught to us. And
mm,
often what happens is when you learn that way, you sometimes pick up the bad habits of other people, you know? So it's good to have a specific session just honing into ECG interpretation so we get the
mm,
technique right and we can really
mm,
interpret it correctly for our
mm,
patients.
mm, mm. Yeah, and I see we have misspelled your name there. Your surname. Sui, I think something is missing there.
No,
Sui
but
Pesat.
brother, I, I think you are
Joking.
throwing me in the sewer. I think you're throwing me in the sewer.
Sorry, brother. You know what you are saying, what you have just said about bad habits is such an important thing. At some point, I was part of people who evaluate maternal deaths. And when things go wrong and then there's an interview with the person maybe was doing the Caesar, they'll be going like, but I've been doing it this way for 20 years, you know? And sometimes you'll feel like doing a wrong thing consistently for 20 years makes it right. But unfortunately, it doesn't mean if
Mm,
nothing happens, if there's no adverse event, you kind of like think, no, this is how it's supposed to be done. So it's very important that there is a point of reflection, teaching, and people can evaluate how they are doing things currently versus what is being taught so that change can happen. So yeah, but my last question for you today from me is, for someone like me, who's very fearful of ECGs, and then I saw the reciprocal thing, I was like, nah, this is something else. Can I ever be as confident as you?
You know, they say, brother, repetition is the mother of learning.
Yes.
So knowing the proper technique and then repeating it and fleshing it out with patient after patient after patient, eventually it becomes like second nature. So yeah.
Awesome. 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 So remember, colleagues, I said have a goal to become better every day. That would require you to commit time to your continuing professional development. Imagine if you are seeing these traces every single day for 30 minutes, like every single day. Actually, generally speaking, by the time you see it for the sixth, seven, eighth time, you are very close to being, very good and confident, but also knowing what you know, because sometimes the challenge is knowing what you know versus what you don't know, kind of like a thing. And I'm also
Mhm.
happy to say that we also have WhatsApp groups, so after this intensive training, you get access to WhatsApp groups where people post their traces. You can also post yours. Colleagues will comment, and Brother Ryan will get some time in between to come in and say, yeah, I think here, maybe check for pulmonary emboli or check these markers, So also remember, from theory to practice, we require a mentorship in a rural setting. That's a very there's an access issue to people who love mentoring people, and we think digitally we can try and really make it easily accessible. Santos says, how much should I pay if I want to continue with the internal medicine? Hey, Santos. Okay, so he's asking about
Santos!
he wants to come back, Brother Ryan. So it's 1,000 rands, Santos. So let me tell you what happened so that I explain it properly. If you joined this diploma program, you will have 3 months of these coaching events where we go through all systems in the body. After that, you have access to your content for at least 12 months, right? It will expire after 12 months. But you'll find that if you want to ride next year, maybe you feel like you still want to join the live sessions and stuff. So the continuation fee allows you to get access to the live sessions. You must have been part of the previous cohort, And it's a 1,000 rand sort of continuation fee. And many people continue to join just for your own professional and to master. You heard Brother Ryan, seeing it once is not good enough. So maybe seeing it again and again, you also have interesting questions and it makes it quite engaging, right? So, from an administrative point of view, colleagues, just to address a couple of things, I've addressed that this session will be accredited for at least 7 clinical points. You must attend to get the points. If you fail to attend, you can still complete the program self-paced. So if you go through the self-paced modules after the ninth and you go through all of them and you complete the small assessment at the end, you will get your certificate and the team will be able to pick up that you have completed and your CPDs would be lodged. This answers the common question to say, Saturday I'm getting married, but maybe I wanted to attend. So just register, get the self-paced version, and go through it. What's the other common question? I think I've addressed the issue of even if you are a non-member, you will get access to that. Yeah, I think I've responded to all questions. Colleagues, give us a sign. Are you guys good? Maybe with a thumbs up before I ask Brother Ryan to do his closing remarks. Are you good? If you have questions, feel free. We still have few. Okay, I see a lot of thumbs. Who's joining us this Saturday? If you are joining us this Saturday, type in a yes there in the chat. Let me type mine in the meantime, just to confirm that I'll be with you. Yay! I'm going to. Okay, Ntotila, I really look forward to connecting with you on Saturday. Colleagues, as you respond, let me ask Brother Ryan to say his closing remarks. Thank you.
Thank you, brother. It's just that I want to clarify. You said you're getting married on Saturday. How many wives do you have?
Can't afford more than one. Can't afford more than one.
Hey, it's expensive. Eh? No, thank you, everybody. I don't have much to say, just to say thank you to Brother Mawela and to everybody who attended, and I hope to see you on Saturday. Thank you so much.
Thank you. Thank you. I see you have about 7 people watching us on social media. Colleagues, you know, if you type there on Facebook or I don't know, LinkedIn, wherever you are, we can see it here. Feel free to engage and to type in if you have any questions. Otherwise, when we log out, I will check if there were any questions from your side. All right. Before we close, let me share with you two or a couple of important links that I think you would need. The first one is to remind you that the ECG Masterclass is happening, and the link is there for you to explore and to plan to join us properly. The second one is to say if you want to master internal medicine, so the ECG is there, just a corner. You want the whole thing, join the 3 month coaching program in internal medicine. I don't know if the link is active on your side, but you let me know. Just join for now, register your interest. Just click the link and say, hi, I'm Lesego Mawela. This is my email, and I'm planning to join the diploma when we start in October. And then the team will reach out and try to help you as much as they can. And then the last part is to say that we are a membership-based platform for CPDs and reporting to councils, etc., etc. As soon as you join the membership program, you have access to over 140 CPD accredited courses across disciplines. You just choose what you want, you complete. And remember, we do 160 live webinars in the evenings. So you'll be able to get CPDs in addition to the education if you do that. Otherwise, drop us an email at info@clinicalcareplatform.com for any questions or queries that you might have. Let me find that email address so that should we log off before you have the links, you can just drop us an email. And yes, we can't wait to connect with you this Saturday. Please don't forget, towards the end of the month, we are discussing dermatology, neurology, and statistics in the context of clinical medicine, internal medicine. So we can't wait to connect with you. On that note, I'm going to replay. You see, that's why I like self-paced. You see, now Brother Ryan will be telling me, no, well, I'm tired. I'm exhausted. Don't ask me to do it again. He wants to sleep. But now I'm going to play him 10 times. Night, night, colleagues, till we meet again on
Bye.
Saturday. Bye.
So it's time for us to see this in action. A beautiful 12-lead ECG, right? We're going to take about maybe 5 seconds just to stare at this ECG and try and decipher what's going on. All right. So here we have it. List the main abnormalities. We see beautiful ST elevation in the inferior territory. 2, 3, AVF. Boom. Very nice. But that's not all we see. We also see ST depression with inverted T waves in lead 1, right? We also see it in AVL. There we go. And in V2. Hello. This is what we call reciprocal change, right? We are infarction in one area, and looking at the heart from another angle, we see ischemia. We took that same ECG and we flipped it around, right? And if we read this ECG from right to left, then what was ischemia, as in 1, AVL, and V2, now looks like ST elevation myocardial infarct. If we look at what was infarction in 2, 3, and AVF, if we read it from right to left, now looks like ischemia. That is the beauty of the electrocardiogram, because guys, we're looking at the same heart, but from different vantage points. Hence, we use the term reciprocal change. So this is an inferior myocardial infarct. But in the anterior territory, we have ischemia. That's reciprocal change coming from the inferior event.
Right. Night, night, colleagues. Brother Ryan, so happy to see you with your son. Blessings, blessings, blessings galore. Bye.
Yeah.
Ooh, nice.